Our next guests are two board-certified plastic surgeons who host Lipstick and Lipo, an Instagram live show where they break down everything plastic surgery related. Please welcome to the show Dr. Smita Ramanathan and Dr. Ashley Amalfi. Thanks, guys, for joining us.
Thanks for having us. We're so excited to be here.
Well, we're excited too. But before we get started, how did you come up with Lipstick and Lipo? Were you in there doing liposuction, thinking of names for your podcast, or what?
No, the whole idea was sort of born during quarantine, and we were just trying to figure out ways to stay engaged with our patients and educate. And Ashley and I are dear friends for many years, and we just thought, hey, let's just do this together and make it fun and interactive and just, approachable for patients to watch and really learn about plastic surgery.
Lipstick and Lipo is really about us being women and talking about lipstick and girl stuff and liposuction, and that's sort of the reality of our lives as sort of normal women but plastic surgeons. It's been really fun.
I'm not going to do lipstick, but I'll do a little powder. Is that all right?
So we're talking trends for 2021, Dr. Smita, which has been, such a hot topic for everyone. Tell me, what have you been seeing in your office?
I think really the biggest trend and shift that we're seeing are just patients are coming in wanting more natural results. I think in the past it was bigger is better, right? People wanted bigger lips, bigger breasts. And now I'm just seeing more patients coming in. They want subtle enhancements. They want natural results. They're doing these procedures for themselves so that they feel better and more confident, but they don't necessarily want other people to notice that they've had something done.
This pivot to natural beauty is quite interesting. What other procedures, Dr. Amalfi, are you seeing that are trending right now?
So we've seen, going along with the natural look, a big rise in natural breast augmentations with fat transfer. So this is really popular because, number one, every woman wants liposuction somewhere. And so we're able to really move that fat. So we take the fat from an unwanted area with liposuction, and then in name of that natural augmentation, we are able to just give the breast a small boost. So it's nothing what a large implant would do, but it's just a subtle boost to the breast to fill the cup size. And then after that, we can regraft into the same area. So for someone who wants more of an enhancement, then we do a second round and we can regraft into their own tissue.
That's a huge, huge trend. We don't like to throw away that fat. We get that fat and we can put it to good use. You alluded to using it in the breast. We love it. We literally can put it anywhere in the body if you want more volume in the face. Dr. Smita, you've also noticed a big trend in fillers in general and lip augmentation in particular. You want to talk about that?
Absolutely. I think lips are, with Kylie Jenner, people really started thinking about getting lip augmentations. And the biggest issue really, and the biggest hurdle is there's a lot of swelling and bruising that can happen with the lips, more so than other areas on our face when we do fillers. And the benefit of wearing masks now is you can get your fillers, cover it right up with the mask, and no one will ever know that you had a procedure done. So I think we're seeing a lot more lip fillers, as well as some other procedures as well.
Yeah, the Zoom boom has been good for business, right, docs?
Absolutely. Just like we're staring at ourselves right now on a screen, everyone who's working from home is doing that, and they're noticing subtle things that they didn't notice before. And oftentimes, those are great procedures that we can do in a non-invasive way with Botox and fillers. Jaw enhancement with fillers, where people can have a more pronounced chin or that chiseled jawline that they've never had. Liposuction under the neck to just slim the neck. And we see a lot of people who are really stressed from the pandemic and are grinding their teeth and having jaw pain, which creates a very square facial appearance. And so we're doing a lot of Botox to the masseter muscle, which just slims the face and also can alleviate some of that jaw pain.
Well, ladies, thank you so much for joining us. A big thank you for sharing all these upcoming trends in plastic surgery. And hey, listen, natural sometimes is better. So we appreciate all the information.
Thank you so much.
For more information about what you've just heard today, just go to our website. It's thedoctorstv.com.